I recognize the member from Saskatoon Eastview.
Thank you, Mr. Deputy Speaker, and I want to just show some appreciation for the member who spoke directly before me for his revisionist history that had us chuckling over here over and over again. I wasn't expecting to laugh so much when I came to work today. You know, I want to start by just having a look at the motion that's before us, and I'll start from the premise that the members opposite are absolutely entitled to their own opinions, but they're not entitled to their own facts. And Mr. Deputy Speaker, the motion says that the Sask Party Government handling of the COVID-19 pandemic has damaged Saskatchewan health workforce. That is a fact. And my source for that, which I have not heard yet from any members opposite, is the healthcare workforce. What do they have to say about this government's handling? I'll get to that. Moving on, that the government has made life harder for Saskatchewan people waiting for surgeries and other treatments. That is a fact. It is an undeniable fact. And my source for that I'll get to today are the people of Saskatoon Eastview. And I'll be reading their direct words. So if the members opposite want to argue with healthcare workers, they're welcome to reject this motion. If the members opposite want to argue with the people of Saskatchewan who have absolutely had their lives made harder by their choices, then today you will argue with the words of the people of Saskatchewan. I welcome you to do that. Mr. Deputy Speaker, I want to start with reading an email that was sent to the Premier and to myself by a resident of Saskatoon Eastview. I have her permission to share. It's from a constituent named Rachel. And I quote, "I am writing to you as one of hundreds of thousands of responsible and concerned Saskatchewan residents who are seeking a safe path to recovery from the COVID-19 pandemic. Let's be clear. We are all tired of adjusting our behaviours in order to keep ourselves and others safe. We wish to resume our lives in a more normal manner. On January 31st, you proposed that the preemptive removal of our public health orders, mandatory masking and proof of vaccination would occur outside of the medical advice that you've received. Instead, you called a convenient sliver of data that supported your political agenda. Instead, you relied on anecdotal account of constituents demanding that we get back to normal. Instead, you repeated anti-vax disinformation talking point that our vaccines do nothing to prevent infection and transmission. If you are not prepared to do your job in an intelligent, science-based, thoughtful, and inclusive manner, please step aside." End quote. Mr. Deputy Speaker, the result of that has been damaging. The result of those decisions has been damaging to my constituents. And it is my job, as it is the job of every member opposite, to speak up when their constituents are being hurt by the actions of the government. I want to get to another email, this one from a constituent who did wish to remain nameless. But as the motion says, that the government handling of the pandemic has damaged the workforce and made life harder for people. This constituent writes, quote, "I have grave concerns regarding the proposed lifting of public health measures by our Premier. Personally, I am a cancer survivor, now in high-risk screening program. I'm supposed to be scheduled for medical imaging every 6 months. My last appointment, which should have taken place in November, is now scheduled for the end of this month. Prior to this wave of the pandemic, my other appointments were pushed back as well. Hopefully, this does not result in any serious outcomes for my health." Mr. Deputy Speaker, what does it say when constituents write out of fear for their health, not from getting COVID, but because they cannot get the cancer treatments that they need as survivors because of political decisions that this government has made to protect the most extreme factions of their base? Mr. Speaker, My colleague from Saskatoon-Fairview talked about service disruptions. Due to this government's choices, we have thousands of Saskatchewan residents who have not gotten the care that they need. We highlighted that throughout the fall session when it came to the Delta variant and that wave in Saskatchewan. That continues today. Absolutely, folks in Saskatchewan are not getting the care that they need during the Omicron wave, which continues despite this government's negligence, perhaps due to their negligence. And Mr. Speaker, folks are not getting the care they need. All of the members opposite should remember when my constituent, Jessica Bailey, was here in the Assembly. She joined us during the fall session to share about her heartbreaking journey. And Mr. Deputy Speaker, I want to say that Jessica embodies the courage and the resilience of Saskatchewan people, but she should never, ever have been put in the position that she was. She's become a voice for all those who've been ignored, forgotten, and left to die by the immoral actions of this government. Jessica is 36 years old, Mr. Health Minister, 36 years old. She was scheduled for a kidney transplant. A kidney transplant that she was unable to receive because that program ended for one reason only: this government's decisions and that health minister's decisions, Mr. Speaker. Jessica was ignored, left to suffer, left for her health to deteriorate because she couldn't get the kidney transplant that was scheduled for her in September. I'm here to report that Jessica's health has not improved. Jessica was unable to get back on the transplant list because the coordinator of that program was redeployed, working on COVID. She could not get back on the transplant list because of the decisions of this health minister. When that coordinator returned to her position, her health had deteriorated so badly that she was ineligible for a transplant. That is on this government. And each one of the members opposite that support these immoral policies should be able to answer for why Jessica has been left to have her health deteriorate so badly that she's ineligible for a transplant. It's shameful. I heard from another constituent in a similar situation. Her husband is stage 5 kidney failure. He can't get on the transplant list yet, but that might be in his future, and hopefully that care will be there for him when he needs it. She went to the doctor with her husband, and her family doctor told them that their best option is to leave Saskatchewan to get the care that he needs. They're unable to leave Saskatchewan because they have a child that has other specific needs, and they need to be here for that child to be part of a community. Can you imagine, through you, Mr. Speaker, to the members opposite, could you imagine being told by your health provider that you need to leave the province to get the care for your husband and having to choose between providing for the needs of your child or your husband? Shame. Shame on this government for forcing her into this position. This is immoral, but the government has actively chosen this path. Politics over people at every turn. Power over morality at every turn. Serving themselves instead of serving others at every chance that they get. Shame. Mr. Speaker, I am nearly at the end of my time, but I want to read just a couple quotes from the Saskatchewan Union of Nurses. From Tracy Zambori, and this is available publicly if you want to know about it. She said it's confusing and it begs the question as to the reasoning behind all this when she was asked to report on why the government was lifting all health restrictions. She said, nurses are burned out, they are tired. If there's an emergency order in place, then we should have the other protections in place. Yet leadership of this province doesn't want to have anything in place to try and lessen the crisis that we're in. That is what healthcare workers have to say. They say the actions of this government do not align with the realities of our healthcare workforce. I will be supporting this motion, Mr. Speaker. I've delivered the evidence and the stories to support this motion. Thank you.